Today, I'm really honored to welcome Elissa Thorner, a nationally recognized leader in cancer care and survivorship. For more than 20 years, she has been a driving force in improving the quality of life for patients navigating cancer, from helping establish the Johns Hopkins breast cancer survivorship program to co-directing the Johns Hopkins Live Well program, where she oversaw clinical care, education, and research initiatives for breast cancer patients. She has served on federal task forces, lectured internationally, contributed to national boards and working groups, served on and currently serves on the Care+Wear advisory board, and co-authored dozens of peer-reviewed publications focused on survivorship, symptom management, screening guidelines, and patient-provider communication. We're not only proud to have her as an advisor, but as an investor as well. Elissa, welcome to Chatting with Chat.
Thank you so much for having me. I'm excited to be here.
Yeah, no, perfect. So I guess we'll jump right in. So I think what's really cool and unique about your background is you've spent more than 2 decades focused on survivorship and quality of life before, candidly, anyone else was even talking about this, I think. And so when you look back, I guess what feels most different about how we think about cancer care today compared to earlier in your career?
Yeah, no, I really appreciate the question, Chat. I think it's a great place to start. So I will tell you that when I first started this, and to give you a little bit more of a background about me, is I was actually diagnosed with breast cancer when I was 23 and then 25 again. So it was very personal to me from the very beginning. And I'll tell you that when I was diagnosed, I was a runner. I'm really high energy. And treatment left me feeling very broken. I went from, being an athlete to not being able to walk up a flight of stairs. And every new symptom I had, I thought it was my cancer spreading or a new cancer. I cried at 3 o'clock in the morning. And when I asked my providers about this, they sort of shrugged universally and said, "This is the cost of being alive." And so for me, survivorship isn't just about keeping people from dying or prolonging life, but it's about really living well for as long as possible. And not just living, but the amount of days, but living well during that time. So for me, in my situation, I remember asking my doctors about things like fertility. And I had a doctor say to me, "Well, Alyssa, do you want to live or do you want to have babies? Because that's what we're dealing with." And for me, my response to that was, "I want to live so I can have children. So
Yeah.
let's figure it out, right?" Um, and so survivorship for me is about addressing those kinds of things, talking about them early, talking about fertility, talking about side effect management. I'll tell you early on, I remember going into a patient's room and saying, "Great news, your cancer is really responding to the treatments we're giving it." And I thought it was going to be a quick visit. I was going to pop in, pop out. It was going to be great. And she broke down and started crying and said, "I don't want to live like this. The GI symptoms, the nausea, the vomiting, it's awful." So it really sort of tuned me in to say, like, it's not enough that we are looking at tumor markers or scans. We need to look at the whole patient. And that's what survivorship is. It's about asking people what are their goals of treatment? How do we keep patients informed? How do we activate patients and their care partners? And moving away from that paternalistic model is sort of what I've been sort of trying to focus the last 20 years on. Our providers may know cancer, but they don't know the person. And so, how do we share the care with our patients and with their families to say it's about getting you what you want and keeping you well for as long as possible?
No, I love that. And I think I mean, you're harping on so many things when I think about a lot of my friends who have uh, thrived and overcome breast cancer and the discussions about children and what the impact on the treatment would be. And now many of them are incredible parents, and it's pretty amazing to see. And I think even it's exactly why I started Care and Wear was how do you, I remember, like I used to say, we just want you to live your life. And I think cancer, of diabetes, whatever today that you might be facing, it's just a speed bump or just something that you can overcome. But while you're going through it, letting you live your life. And I still remember when we first started, one of our first customers was a collegiate athlete who wanted to keep running. And I was like, this is amazing that we get to let her keep running, but I'm also terrified at the same time that, hey, like I've never done this. Like I don't know. Hopefully it works. And we're really grateful to get to allow her to keep her collegiate running career going. So amazing. Well,
So
you've
can
seen,
I just sorry
yeah,
to
yeah,
interrupt you? I
yeah,
just want to say I love that the thrive is really where I think survivorship is.
yeah.
And the other thing that sort of jogged my memory when you said that is I remember treating a professional violin player. So she played for an orchestra, and we had this treatment, and we knew what the best treatment was going to be for her, and it was going to be a treatment that was probably going to cause her some neuropathy, so burning in the fingers and losing sensation. And to me, that's another thing, like what hearing you're talking about a collegiate athlete. It's about asking patients, so you're a violinist, we don't want to take that from you. So
Right.
what do we need to do to make sure that you can still have your goals, have your career, live your life, and not just be cancer free, which is
Yeah.
was the goal once upon a time.
Right. No, I love that. And you've started to answer some of this, but like in your experience helping build Hopkins breast cancer survivorship program, what are some of the key components required to move from treating cancer to truly supporting survivorship and letting you thrive and live your life?
Yeah. So, what I would say is one of the things that we've really stressed over the years is that survivorship isn't something we sort of do sequentially. So, it's not something we talk about at the end of initial treatment if we're treating you with curative intent. But to me, survivorship is looking at the time of diagnosis. So, to the example that I gave with fertility, those are the conversations we need to be having before anything happens. Or with the example of the neuropathy, we need to be asking you what your goals are before anything happens, like I mentioned.
Right.
So, I think that's part of it. I also think that we want to talk about the goals of treatment and caring for the whole patient. So, again, it's this idea of not just removing disease, but it's the idea of psychosocially. Are you crying in the shower? What's going on? How are things at home with your husband or your kids or your friends? Are there issues with cognitive challenges and chemo brain? If sexual side effects are an issue, let's talk about them early. Let's not wait until we leave you broken.
Right.
For the example of the collegiate athlete, or for me, I didn't want to wait until I was so deconditioned. Let's talk about how we can do prehab or set exercise goals early on
Yeah.
so we don't leave you to not be able to walk up a flight of stairs.
Basically, what I'm hearing is preparation and planning are kind of key to success and listening, right? Like at the end of the day, it's that joke, and I feel like I can say this because my mom's a doctor, but it's the joke that doctors never listen to the patient, but allowing them to listen to what you want out of the treatment and how you want to be kind of undergoing it, and candidly, like what kind of pain threshold or what are you willing to withstand as well? Because let's be
Yeah.
honest, it is not the easiest thing, and I think it's what inspires us at Care+Wear every day is just seeing. I mean, like I complain about the temperature being too cold, and it's like, what the hell am I complaining about? Like I'm a relatively healthy person,
Yeah.
right?
Yeah.
And I think it gives you a great perspective for sure.
Yeah, and I think to your point, asking the right questions early, but asking
Yeah,
them often. So it's not just sort of this survey before treatment
right.
begins. The right questions early on, asking them at the right time. And then I'm sure we can talk about this a little bit later, but also utilizing that data. So it's
Yeah,
not just like checking boxes, but how as clinicians can we take that information and then have that inform the care that we're recommending?
right. No, for sure. Okay. So as we think about, we're in the business of innovation, I guess, and as we think about how it's often equated with major breakthroughs in oncology, what practical innovations have you seen quietly transform care delivery?
Yeah, so I will tell you that I, of course, like most people in my world, nerd out about things like AI and what it can do
Yeah,
for us, or things like when I first started in this world, there were very few, if any, targeted therapies. So the idea of just targeting cancer cells and keeping healthy cells alone, or immunotherapy is sort of one of these terms that is
yeah,
really sort of blockbuster breakthrough. So those are all really exciting things of things that we couldn't have dreamed of, or at least I couldn't have dreamed of 20 years ago.
right.
So those are really cool. But I think it's sort of the smaller things, or maybe not smaller, but sort of less blockbuster, are sort of this idea that We ask what matters. So measuring
Mm,
side effects, measuring physical function. Again, these things weren't talked about. It was really
right.
like
Yeah.
the
You never, yeah.
dichotomous, like, are you going to live? Are you going to die? And if you're going to live, we're going to take you to death's door, and you're going to be really grateful us for keeping you alive. And that doesn't really play anymore.
Yeah.
So the idea of, again, looking at patient-reported outcomes, asking questions about side effects, physical functioning, that allows us to do things with early interventions, improve quality of life. We can go beyond the labs and the scans to sort of look at the whole patient, this idea of shared care, that it's not just this doctor making a decision, but that everybody is sort of equal play on the playing
Yeah.
field. We have things that are super cool that weren't around a long time ago, like multidisciplinary conferences. So this is idea of like tumor boards, where we're bringing together oncologists, pathologists, radiation oncologists, social workers, navigators, all in the same room, looking at the same patient from so many different angles. So that is sort of a cool way of saying we holistically want to treat the patient, not just the cancer.
Right.
Um, Things like patient navigation, which we can talk more about if you want, but things that help with adherence to care, allows us to spend more time with our patients, ask the right questions, making sure that care is accessible and feasible for our patients.
No, I love that. And I love basically every answer of yours has said, basically put the patient first, right? And like treat them like a human being. And I think that's so important. Um, so you're very unique because you've had a front row seat to research, clinical care, and policy. Where do you see the biggest opportunity right now to better connect patient experience, clinician workflow, and long-term outcomes?
Yeah, so I mentioned this a little bit, but I really am excited about this idea that we're using electronic medical records to do things with patient-reported outcomes. So this
Yeah,
idea that we're helping measure what makes patients and their experience happen. So this is a way of reporting back to providers symptoms, side effects, looking at well-being, quality of life. Came across this quote the other day, which I thought was like amazing, which was when the doctor asks, quote, "How are you?" and you say, "Fine," the doctor thinks he or she has done their job and gather the clinical facts while you think you've just been polite. And that really resonated with me because I think
yeah,
the doctor's looking at it, oh, the patient's fine, I can move on. And the patient is saying, wait, I was just sort of making small talk. There's so many things that are going on right now. So the idea of patient-reported outcomes allows us to go beyond those lab results and imaging and really check in with patients. As I've already mentioned, I'm really get excited about patient navigation too. It really reduces diagnostic issues and sort of roadblocks that patients face. It helps with adherence to care. Um, it helps us, it often can be a first line for patients when they don't know who to ask or what the issue is to call the patient navigator and help coordinate the care that may be necessary. Navigators are really great at looking at work and family issues, practical concerns, community resources, and say, hey, it's not okay that you're crying in the shower. Let's get you to a support group.
right.
Uh, so I think those are really great ways to empower patients.
Love that. So I was trying to figure out when we first met. I think it's over 10 years ago.
Longer. Yeah. Yeah.
Yeah, so you've gotten to be a part of our journey and our story since the early days. And so you've gotten to see it, but you've also stayed involved the entire time. And for those that don't know you, you're quite a busy individual and you're really bad at saying no to anything. So you tend to overexert yourself on everything. So I guess working with our team and the Care+Wear company as a whole, what about our approach to cancer care feels meaningful or differentiated to you?
Yeah, well, like you said, I didn't realize it had been 10 years, but immediately when we met, I was drawn to your vision. And I don't say that lightly, but I love that you've created a company that isn't just about the bottom line. I think a lot of companies are looking at dollars and cents, and
Yeah,
I'm not a marketing person and I'm not a business person, so that doesn't resonate with me. Like I can
right.
barely balance I don't even want to say checkbook because I don't even do that, but
Yeah,
I'm not a numbers and cents person, but I really love that you focus on the patient or the provider,
right.
and you create things that are well made and they're useful for the patient. So it's not just about like sort of cornering the market. Specifically, what sort of is my world is you've created a mastectomy bra that I think is above and beyond anything I've ever seen. And I've seen a
Yeah.
lot over the 20 years that I've worked in this. And that's not just mastectomy bras, but also the port access shirts, which are something that I refer to patients all the time to, that they're comfortable. We talk fabrics in our meetings. We talk about how they feel, how they wash. We talk about colors and if they look attractive. You know, I
Yeah.
always we joke about one of your mastectomy bras has got like animal print, and I thought like
Yeah.
it's a time in your life where you feel, for most people, pretty unattractive. And it's a way of saying, like, I don't have to feel awful all the time. And I can feel a little bit
Right.
attractive or a little bit sexy, and that's great. So the idea that we're focusing on fit and color and wear, I love. And another project that we worked on with you guys is you had us all wear your PICC line covers, which
Yeah.
was definitely an experience. So we had to
Yep.
sweat in them, and we had to, put them on right after the shower. And they got, just anything that you wear for 2 weeks gets gross. And
Right.
how did it smell? How did it wash? And so we got to experience firsthand how these products really make a difference in patients' lives. In terms of the scrubs, like anybody can make scrubs, but to talk about scrubs and how they feel after a long shift, we talk about hospitals either being really cold or really hot, but it's never anywhere in between. It's never
Right.
comfortable in a hospital. And how do you make things that you want to wear for 12 hours plus in a shift and still feel good on when you come home?
Yeah.
So I love the products you're creating. I believe in them. I recommend them to people. And again, it's not just about, who can sell something for the cheapest amount and make the highest profit.
No, I love that. And obviously, you've been a huge part and component of helping us create those products. So thank you very
Mhm.
much. So now I have some quick fire
Sure.
questions
Do it.
for you. What is your favorite restaurant right now?
Oh, good question. So there's a restaurant in DC that I've been going to. It's a Jose Andres restaurant called Zentinia in DC, and it's
Yeah,
a Mediterranean tapas restaurant. So I'm loving that at the moment.
love that. What is a good book that either you're currently reading or recently read, or even recently can be last 5 years or whatever? What's a book for everyone
Oh,
listening that they should get their hands on?
oh, that's a great question. I have to think about that one. Yeah, let me think about that one. I'll come back
Okay.
to that. Give me
Yeah,
a
we can
minute
come
because
back.
I'm in a book club and we read very quickly. So I'm trying to think of what I've
Got
actually
it.
recently.
Yeah.
Yeah.
Um, I need book suggestions for my time on the beach too, so I'm cheating by asking that.
Yeah, so nothing good there because like I read all like medical stuff,
Oh
right? So
yeah.
like yeah, but let me think about it for a second.
Yeah. What Baltimore or DC?
So that's a tough one because I grew up in a DC suburb and
Yeah.
then went to Baltimore for graduate school and really hated Baltimore. Was like, I'm never going to be here for more than graduate school and then
Yeah.
didn't leave. So I called Baltimore home up until a few years ago, which and then I moved back to the DC area. So they're good for different reasons, which is a very
Yeah.
political answer, but
Yeah, not pissing off anyone in either
there
city.
you
I like
go.
that.
That's right. That's right. That's right.
Okay, how about Orioles or Nationals?
So again, that's picking one or the other, right? So,
I was
you know,
trying to cheat there. You called
there
me
you
out.
go.
You're good.
I'm
Yeah.
gonna have to go Orioles there.
Love that. Let's go
Yeah,
those.
yeah. No, I mean I grew up like the Nats are new, and I grew up like
Yeah.
the Oriole. Camden Yards is pretty amazing. So
Yeah. Yeah, it's incredible how that stadium has still kind of outlasted so many
yeah,
new ones that were built.
that's right. I think that's a really yeah.
Um, cool. And then lastly, what is, if you could go anywhere in the world next week, where would you go?
Okay, so I was supposed to go be in Vietnam last month, and the trip got canceled last minute, and so
Oh
I'm
no.
still like grieving that.
Yeah.
So maybe there. Although I have a girlfriend of mine who's planning a trip to Patagonia, and I was there a few years ago, and I'm reliving those memories. So
Yeah.
it's a toss-up between eating amazing street food in Vietnam or like hiking Patagonia.
I went to Vietnam in business school and it was incredible. The people were amazing.
Yeah.
Yeah, it was a trip of a lifetime for sure.
Yeah, yeah, I did. 2 years ago, we did Thailand, Laos, and Cambodia, and just didn't get to
Yeah.
Vietnam. And so that's been on. I've had the itch for that for a couple of years, but I'll get there maybe next year.
Yeah, exactly.
Yeah,
Perfect. Well, this has been great. Thank you so much
yeah,
for taking the time and for everyone listening, thank you for listening to another great episode of Chatting with Chat with Alyssa.
Thank you so much. Really appreciate the opportunity. Good to
Yeah, of
see you.
course.